Whether it's from lugging your little ones around, bending your back the wrong way, or a devastating accident, back pain affects 80% of Americans at some time in their lives. Mark's case is extremely severe, but a new procedure promises to give him his life back.
I used to be a machinist, firefighter. I was very energetic. I fished, I hunt, and it just went away with a back injury. I fell and landed on some piping, and it was about 12 feet.
Since Mark's injury, our life has come to a screeching halt.
I went off work. I couldn't pay the bills.
The last 3 years, it's just really gotten so severe that he's just either in bed or on the couch.
I'm missing everything. I'm missing the world. I missed a lot. I want it back.
Mark had had back problems for a number of years and has been incapacitated by these back problems.
I'll be okay. I'll be okay.
So our surgery today is called the extreme lateral approach to the spine, or XLIF. This technique is revolutionary for a number of reasons. One, it's minimally invasive. Importantly, we leave those strong lumbar muscles intact. We're able to go through and get down to the disc from this lateral approach, take out the disc in its entirety, and then replace it.
We're looking for where we're going to make our entrance wound. We need to make it straight above the L4-5 space. So our initial incision will be the safety incision. Our next step will be using a probe, which is able to be seen by X-ray. This will allow us to go through that muscle without damaging any of the nerves. So this next device is really what has allowed us this new and revolutionary surgical approach. It is a retractor system. We can expand this to give us a working port. We're looking directly at the lateral disc. Now we're going to enter the disc space with a disc knife. It's a retractable knife. So we're actually in the disc space now, scraping out what I'll call bad disc. All right, we're ready. Implant. So here's our implant. In the middle of it, we have a product that is an adult stem cell product. These adult stem cells will be put in the implant. They'll then, over the next 3 to 6 months, go into bone. I think we were able to accomplish all we wanted to accomplish, essentially reconstructed this segment of the spine to an incision about this big.
Mark is here now with neurosurgical spine specialist Dr. Ian Armstrong, and we were just talking 3 days.
3 days. 3 days. I feel like $1 million.
You're up walking around? Come on back, Mark. Don't run away.
It don't get no better than this. It's great. It's great.
So this is an amazing new surgery. How does this work?
Well, this model here is a torso on its right side, and what makes this approach revolutionary is that we're going through the side. The older approach, we would go through the back muscles and destroy those back muscles, or we would go through the stomach muscles and damage the stomach muscles, which would take a long time for the patient to recover. With this new approach, we make about an inch incision, go in through the side. We're able to use the retractor, pass this retractor down with electrical stimulation, guiding us through these nerves and muscles safely so we can get right down onto the disc. Once we're in the disc place, we can then move in with our instrumentation, again, all developed for this special approach, and then we can work through this portal and remove the damaged disc. It's really amazing, even for a spine surgeon, to see something this minimally invasive and see the results that we get with patients like Mark.
Because of the recovery, if Mark, let's say, had the old-fashioned technique done, how long would he have been recovering?
He would have been in the hospital for at least 5 days, and then several weeks recovering, and then not really up and functioning for 4 to 6 months.
Whereas with this, he's 3 days out, trying to run off the stage, by the way, which is very impressive.
I'm ready to go dancing.
And he'll be back to routine activities in 4 to 6 weeks, and I know Mark's anxious to get back to fishing with his grandson, so he'll be back to that in 4 to 6 weeks.
And be dancing soon, too.
I'm ready.
So who else other than someone like Mark would be a good candidate for the XLIF procedure?
Well, I think the important thing is that a patient with incapacitating pain, someone who cannot live with their symptoms, cannot provide for their family, cannot recreate, and is taking pain medication all the time, and importantly has failed conservative management. Someone who's been through chiropractic, physical therapy, pain management, all these things Mark had gone through. Once you get to that crossroad, I think that patient becomes a candidate for surgery, at least a consideration for surgery.
Because surgery is obviously the last resort. 80% of us will experience back pain at some point in our lives. Talk about in the ER all the time, certain warning signs where you really need to go get seen, because sometimes we bend over, we tweak our back.
Sure.
No big deal. We get better after a few days. What are the warning signs we should tell people about?
Well, I think the things to watch for are progressive back pain, night back pain, which can be a sign of infection or tumor. Certainly leg pain with weakness and numbness. When you have progressive weakness and numbness or bowel or bladder problems, these are signs where you need to get to your specialist and get evaluated.
What do you recommend for people at home that they can do on their own? Obviously anti-inflammatories, some people will benefit from those. Any other things people can do at home?
Well, I think the most important thing to realize is that when you have back pain, most of the time it's going to be spasm or strain. And the old school was to lay in bed and rest.
Right.
And I think now the anti-inflammatories and activity, and guided activity by your chiropractor, your physical therapist, I think is very important. So getting up, moving, ice, soft tissue work, those sorts of things can be very helpful and get you back to functioning much more rapidly.
Not this activity. We're not talking about this. That's the worst activity. Always, and I tell everyone this, bend with your knees, not with your back, and you can stave off back injuries. Mark, best of luck to you.
Hey, I got
Thank
my
you so
life
much.
back.
Dr. Armstrong, thank you for sharing with us. We appreciate it.
Thank you, Doc.
For more information on this procedure and how to treat your back pain, go to our website, thedoctorstv.com. Coming up